Dear viewers, welcome you all to our show, OSA, that is Orthopaedic Solution Academy. Hope you all are well with your friends, family, and your patients. Dear viewers, today our topic is a little bit different topic, but it's very important topic. That is the Ilizarov effect in radiology, and the speaker is the Professor Novikov sir and his team. And the total topic is the Ilizarov effect in radiology, regenerate formation under different conditions. Now, I would like to request Professor Novikov sir and his team to join with us.
Good afternoon, dear colleagues.
Sir. Welcome to our show, OSA.
Thank you.
And dear viewers, we have three learned academic experts from all around the world. One of them is the legendary Ilizarov surgeon from Bangladesh, the Professor Mofakhkharul Bari, sir. I would like to request Professor Mofakhkharul Bari, sir, to join with us.
Good afternoon, everyone. Thank you.
Thank you very much, sir, for joining with us. Dear viewers, we have Professor Omar, sir, from Kurdistan, Iraq. I would like to request Professor Omar, sir, to join with us.
Good afternoon, everyone. Thank you so much. Good afternoon.
Good afternoon, sir. Thank you very much. And now I would like to request Dr. Shamsul Huda, sir, from Patna, India.
Very good afternoon and greetings from India.
Dr. Shamsul Huda, sir, good afternoon. Thank you for joining with us.
Good afternoon, and thank you, Tanvir.
Dear viewers, now I would like to request our honorable speaker, Professor Novikov sir, and his team to start his presentation. Professor Novikov sir and your team, would you please share your screen and start your presentation, sir?
One more good afternoon, dear colleagues. And today I want to introduce another Ilizarov's member. This is radiologist, doctor, very good doctor, and without these specialties, we cannot get excellent result. This is material I took from radiologist, and I am happy because it's my wife. And just now you can see our teacher, our father, Ilizarov, and most of his photos all time with X-ray in the head. And without X-ray picture, without understanding what we can see on X-ray, we cannot get magic result. And during these few minutes, I want to explain for traumatology and orthopedics how very important contact with radiologist. And Ilizarov all time recommend colleagues, please look and think how say Dr. Bari. And you know, our teacher, this is doctor, inventor, apparatus, methods, effect, treatment, rehabilitation, specialized, scientific, politician, orthopedic center. This is everything named by Ilizarov. We have museum, we have airport, we have street, we have place for worship. And this is not only for our methods, for our apparatus, and Ilizarov show us another side of our job. Just now you can see who is it from simple doctor. They just now like planet, like philosophy, like possibilities, support us go away from any difficult situation. And any orthopedist and traumatologist know Ilizarov apparatus. This is metal. Few doctors know what is it Ilizarov methods. And very few, I think, few person know what is it Ilizarov effect. And sometimes Ilizarov, so many doctors talk only about apparatus, but with Ilizarov frame, we cannot support properly for patient who use Ilizarov methods and who start understanding what is it Ilizarov effect can clear quickly and very effective support for our patient. And if you know Ilizarov effect, this is general biological property of tissue to respond mitral stretching or compression by growth and regeneration. Unbelievable forces from our body. This is genuine and magic of Ilizarov. And again, you can see on the left side, this is Dr. Kirienko, and Dr. Kirienko show first X-ray and then his patient. And Ilizarov first study X-ray and then touch hand of the patient. And the study of the X-ray picture of the formation of distraction regenerate help to create new opportunities to managing patients. All of our memory, Ilizarov with X-ray. And just now, Ilizarov says, please look not on the beauty girl. Please study and check X-ray, because inside of this X-ray, success of Ilizarov treatment is radiological monitoring in dynamics. And how Ilizarov says what Ilizarov methods. This is bloodless surgery. This is rigid fixation of bone. This is anybody know about that. The possibilities of early loading of operated limb and function of adjusting joint and great position when we can control of bone fragments, all period of this. And I little bit add on this general point and introduce one more component. This is constant control in the formation of a distraction regenerate, X-ray control. And during the treatment, we have a radiography protocol. Preoperative radiological examination, obligatory. Then radiological control of osteotomy in operating room. Then during job period, regular final result, and coming consolidation period, regular X-ray during consolidation once a month in both children and adults. When coming time remove of device, obligatory radiography on the day of removal, of the device. And in the rehabilitation period, X-ray we recommend once in a month, or when patient need it. And please, colleagues, at all stages of treatment, X-ray obligatory in 2 standard projections. Little bit later, I will show why. Because so many mistakes and so many complications come from this is very easy point, because in one projection we can see only one side of problem, and sometimes we lose real situation with on the bone with radiography. And Ilizarov was the first to decipher the radiological text of bone regenerate formation that no one had understood before. Very good picture, little bit not so good, but another picture, Professor Shevtsov, this is a student of our grandfather, and again, all time in the hand of Ilizarov X-ray picture. And the Ilizarov treatment, careful study of X-ray at all stages of treatment. And for example, in operations room, X-ray determinate of surgeon tactics. This is picture I find on the internet, and they show different condition of destruction regeneration. External, straight, attitude, opposite, pillar, agenetic. But like for doctor, this is picture not give me information activities. This is maybe interesting for scientists, but for doctor, this is classifications, how we can say, not giving instructions. And in our center, we have simple but very effective classification, because any type of regenerate, we have instruction for destruction. For example, normotopic type of osteogenesis. What is it? This is we will follow instruction of Professor Ilizarov, normal rate of lengthening, 1 millimeters per day. If we have another, for example, hyperplastic type, sometimes we have this type on the child. And X-ray picture show, please, little bit increase speed of lengthening, or maybe change position of some rods in apparatus. And when we have a hyperplastic type of osteogenesis, this is give me instruction, please, potential of bone not so strong, and we need decrease speed of lengthening. And formation of destruction regenerate, the type of forming determines the tactics of patient's management. During the lengthening process, the type of formation may be changed, because sometimes we have normal, then hypertrophic, then hypertrophic, and the type of formation depends on both the patients and the doctor, on both, and on the final, and mostly from the actions or inactions of the doctor. Very, very important point. And I want to show a little bit some different features of formation and destruction regenerate. For example, lengthening achondroplasia case in operation theater, we check everything with radiography. We check with hand and then we check with radiography. Everything is clear. I am happy, and then after a few days we start how we can say lengthening, and Ilizarov says this is golden rule of Ilizarov. The idle move elements and begins the destruction lengthening by the attending physician with the own hand. Only doctor can understand what is it first step, what is it start lengthening, because hand of surgeon very good feel we start procedure or no, because this is procedure start mother of patient, and this was my mistake, because mother of this patient she is a doctor, she very good understand everything, but from beginning she not feel what is it start of lengthening, and on the first 3 days patient not feel any pain. For us this is information. If we haven't paid, sometimes we make radiography a little bit early than we recommended. For example, after start of lengthening, we recommended after 10 days. But when baby haven't any pain, we need control. We start or not. After 4 days, we have only this amount of lengthening. Then mother continued of lengthening, and we little bit decrease speed of lengthening. And my eyes cannot check something between fragments of bone. After 10 days, we have extra distance between fragments of tibia. 10 days means 10 millimeters, but we have near 40. And for me, this is information. I need a little bit degrees speed of lengthening. And I contact with mother. She sent me this X-ray, and I recommend, please, little bit degrees. And my eyes cannot see this one. Please look on the lateral position, and only radiologist can see. My eyes see distance between tibia, and I understand this is too much, and I can little bit reduce our speed of lengthening. But radiologist see another point. Radiologist already start see hyperplastic of regeneration, means must increase speed of lengthening, but I recommend degrees, and then come in another situation when after 20 days I saw near 20 millimeters, and I recommend continued slowly continued procedure with lengthening. And again, I not understand condition of regeneration. And after 5 days, baby again don't feel any sensitive, any pain, because our procedure little bit sensitive. And with this picture, what I can do. And mother says, we need with manual manipulation, little bit change position of between frames, or we can continue lengthening, but will come in another situation. After a few days, will come this situation. If anybody understands what is it, I can say this is fracture of regeneration. And when this situation comes with severe pain, this is one side of this problem. Another problem, if we have severe forces between frame and then in one moment realize this force to the distance, sometimes peroneal nerve give us bad reaction, and then coming from with paralysis of peroneal nerves. And from this moment, I start any X-ray first show for radiologist, and then radiologist explain speed of lengthening and condition of regeneration. We talk only after consultation with radiologist. And here you can see 30 days, and we have 33 millimeters, near Ilizarov rates of elongation. And then with this condition, I am again want little bit decrease speed of lengthening, but radiologist says, please continue very quickly, because they say this is hyperplastic regeneration, type of regeneration. For me, this is normal regeneration, normal topic. And after 50 days, we have 1 centimeters extra of lengthening. And again, a picture on the right side. Again, radiologist says, please continue your speed with high rate, 1 millimeters 0.5 per day. And on the end, you can see 70 days, and we have near same 72 millimeters between fragments, proximal and distal. And on the end, we have 75 millimeters, and I can say perfect, excellent result, because only 1 month we wait for remove of device. And with this mistake, another side, and now you can see only 10 days. 10 days period of fixation on the right tibia. And for me, coming full consolidation and coming time for remove. But with baby, we continued and remove near 1 month fixation. And just now, I'm any X-ray before I show for radiologist, then I heard his recommendation, and then continued my procedure. And again, Ilizarov taught us to see and think, because from this is small picture, he showed we can see volume of formation, bone formation. I am happy because so many X-rays I see and start understand in front of my father. And just now I show this is picture during the lengthening, and this is like cooking, and this is lengthening of humerus. And 2 days ago I removed this frame, and fixation was so small because all period of lengthening I follow instruction of radiologist and colleagues. If any X-ray you will consult with radiologist, your result will 5 times better than when you see this is picture alone. And let me show a few pictures which I find on the internet or Instagram. Lengthening without the participation of orthopedist and regenerate without regeneration. And which way to go? Because so many doctors in the world use so many different osteosynthesis. And for example, here, everything out of hand, out of control of doctor. And you see on this picture, in operation room, 1 year of fixation, 3 years post-operative. And please, colleagues, calculate this is period of osteosynthesis. 3 years patient with the frame. Today, with Dr. Mirza Muradov, we remove some plates. This is plates, baby, not baby, young girl, continued live more than 3 annus. Years, sorry. Here, annus, this is a Spanish patient. And all of this period, I request calculate like osteosynthesis. Remove plate, finished period of osteosynthesis. Because sometimes doctor says, oh, your Ilizarov frame so long, need fixation. Why here 3 years? Because doctor cannot remove, because sometimes condition of bone not give us permission for remove. And here, so many different osteosynthesis, and when doctor start lengthening with this picture, second picture, then we can see third picture and another picture, 1 millimeters per day, and doctor not control condition of bone regeneration. Our teacher, each X-ray study and think what's happened, where regeneration. Now, doctor is happy because big amount of lengthening, but I cannot see bone formation. And you see 8 centimeters, this is more than 1 year. Imagine this situation in the Ilizarov frame. I can say this is whole. Doctor never check condition because 1 millimeters per day and nothing more. In other case, same story. All of this picture I took from Instagram, and doctor happy because they get amount of lengthening. But for me, doctor not get result with bone formation. And again, this is I took from internet, and now I can say this is like anti-reclama. And you see very big lengthening. docking side. This is defect. And just now, two sides problem, double problem. In distal part, when we haven't enough contact and enough forces for consolidations, and hypertrophic type of regeneration on the proximal part. And for me, this is patients will very big period for lengthening this patient need, and I think another surgery. Like another patient on the right picture, how this is monolateral device, we can change position, and with this condition of regenerate, we can see severe osteoporosis, and what this doctor can do. And again, I think radiologist never give him instruction, and near any chance we can see a big hole with osteoporosis. With the Ilizarov frame, in my experience, all time with the Ilizarov methods, we follow his instructions and we find some effect between fragments. Another model of lengthening under nail, I'm against this technique. Why? Because, please next, show us. We cannot control, we cannot correct simple deformity, and doctor not control condition of new bone. And you can see where new bone between tibia, fragments of tibia. And this is a picture from Russia, from St. Petersburg. I think this is mistake of doctor. They start lengthening on the diaphysis, big amount, and during the lengthening, here not give rest for patient. And just now we can see scent watch formation. More than 1 year fixation, and after remove of this frame, immediately broken. And osteosynthesis by Ilizarov frame, but treatment not for according of methods of Ilizarov. And why this has happened? Ilizarov treatment requires constant communication with the patient through the treatment period. And just now, all of our patient, outside patient, send us by Telegram or by WhatsApp, by Viber, fresh X-ray, and this is situation give us possibilities immediately correct situation during our lengthening, because just now so many patients not stayed with doctor. Patient go discharge from hospital and stay at home, and now with new possibilities we can support our patients very quickly. And again, you know everything this. Можно побыстрее все пролистываем. And we have again, I want to repeat, the Ilizarov method is a constant control of the formation of a destruction regenerate. And before we talk please make two projection. Many weeks, few months, doctor check position of bone with one AP position. A good job, big defect, dock inside on the place, but during 4 or 5 months between this red line haven't any positive information. After 5 or 6 months, change volume of shin, and doctor make another projections and sees and saw this condition of bone. But 5 months, doctor make only AP position and never do lateral position. Another situation with bone defect. 1 millimeters per day, talk inside is good, but when you born, why doctor dislocate middle fragment with one speed, 1 millimeters per day? And just now, doctor make with his hand another defect. Before defect was in the distal part, just now coming defect on the proximal part. And here, maybe good, but on the lateral position, we can see not so good regeneration. Why? Because doctor, during the lengthening, make only AP position and never make lateral position. Small mistake, but big problem. And during my life, I only remove plate, like today with Dr. Mirzamuradov, because this is plate not give permission for bone for breathe. Our wire, Kirchner wire, K wire, give us possibilities with weight bearing, change shape of bone, like a physiological process. Screw and plate permission for amortization. And you see pseudoarthrosis, and here we cannot create a new bone. Here we cannot take Ilizarov effect. And another here, femur, here, forearm, same situation. And sometimes hyperplastic type of osteogenesis, this is, how I can say, a mistake of doctor. On the AP position, you can see one wire, not one wire, many wire broken. And this on the end situation was with unstable condition of fragments. With each step, all of device shake, and we can see just now like hyperplastic. But for me, this is not hyperplastic. This is unstable frame of Ilizarov. And another hypoplastic situation, I think this is clear fault of doctor, because big amount send watch regeneration and severe osteoporosis, because patient, I think, not use this leg for lengthening. And another osteosynthesis by Ilizarov frame and treatment by Ilizarov methods. And with that, we can create, we can see effect of Ilizarov. This is magic of Ilizarov. When we can create new bone, and when we find optimal biomechanical axis for any extremities. And another effect of Ilizarov. This is pseudoachondroplasia patient. And usually orthopedists recommend not touch, only correct deformity and not lengthening. And a few weeks ago, this is patient discharged. And when mother says, amount of lengthening, I cannot believe this is my patient during 10 years. But doesn't matter time. 10 years with pen, with pencil, I show start of treatment. 89 centimeters before treatment. Just now, his height 1 meter 44 centimeters. 55 centimeters clear lengthening by Ilizarov effect. This is magic, and again, I want to say magic of Ilizarov. And when we start think, what is it? And all of you, I congratulate with our possibilities, with our philosophy, with our principle. And I invite all of you for our Ilizarov's reading, which will in June. I invite you in our center for study, for collaboration. And just now I want to introduce young doctor. This is Dr. come from Uzbekistan, and just now this is country has big interest for Ilizarov frame, and Dr. Mirza Muradov, I think he will show next time our small experience in Uzbekistan, because any hospital in Uzbekistan has frame, Ilizarov frame, but doctor not use because Soviet period is already 30 years ago, how I can say, помоги, развалился Советский Союз, but just now,
90 years gone after the Soviet Union. Now in Uzbekistan, the young doctors, they are trying to get up the Ilizarov technique. Dr. Habib from Bukhara, I was there a few days back, and now he's he's in Kurgan for 3 months fellowship on Ilizarov technique.
A few weeks ago, we first time meet in Bukhara, and next year, all of you for first Ilizarov conference, and I think there we can show different our clinical examples. And doctor, with final of this meeting, without radiologist, our result not so strong. This is 1, this is 11. And radiologist can open our eyes, because radiologist can see more than me, more than us. And Ilizarov was great surgeon, and he was happy. His wife was a radiologist. I'm happy too. My wife is a radiologist. And when you will collaborate with radiologist, your result will multiply. I congratulate all of us. We more than 1 year, 1.5 years. Today is the 60th meetings, and I hope our meetings will continue. Thank you very much.
Thank you very much, sir, for your excellent presentation. And I like to thank Professor Novikov sir and his team. Definitely, I would like to thank Dr. Habib, who has joined with us in the Orthopaedic Solution Academy. Dr. Habib, welcome to Orthopaedic Solution Academy. And I think you are the luckiest person that you will be trained with Professor Novikov sir in the coming 3 months, and you will gather lots of knowledge. Definitely share your knowledge with us in the coming part of our Orthopedic Solution Academy. You are most welcome at the Orthopedic Solution Academy. Now, I would like to request Professor Mofakhkharul Bari to say something regarding the presentation. And his team.
Thank you very much. Thank you very much. The lecture was given by Professor Novikov. It's a very good lecture. The lot of questions mentioned everything. The paper was he delivered this paper in Samarkand and at the same time in Bukhara also. So this is a lot of learnings. You have seen what Professor Novikov he has shown here. It talked a lot of things regarding the X-ray findings. We must see before dismounting the apparatus. When we are applying Ilizarov, before applying, we must see the condition of the X-ray. And during corticotomy, we must see, and after how many days, every 14, every 15, or 3 or 4 weeks, we must check the X-ray. And when we see the consolidation is already finished, before dismounting the apparatus, we must again see the X-ray. So the role of X-ray in case of Ilizarov is very important. The effect of Ilizarov that you have seen, lengthening over the nail, lengthening over the plate, we must see everything. So the problems with the Ilizarov apparatus and problems with the plate and the nail, he has already shown. And it's very important, rightly he said, that we must know about the minimally invasive, that we are using the Ilizarov technique, rigid fixation, early loading by Ilizarov, and at the same time, function of the adjacent joints, we can go with Ilizarov. And always we must have ability to control the fragments, so fragments is in proper position or not. And you have seen the lengthening over the nail. When lengthening is going on, the biological parameters given by the Professor Ilizarov, they did not follow that one. That's why they've applied the Ilizarov, but the parameters which are shown by Professor Ilizarov was not rightly followed. That's why the poor regenerate bone. And what happens lecture. Thank you, Professor Novikov, for giving a very good lecture on the effect of Ilizarov in radiology. And this is a very good lecture. And I think this will be learning for all the orthopedic surgeons.
I think, yeah. So please continue, sir.
The effect of Ilizarov, he has compared, he has shown how to apply the Ilizarov. If you don't follow the biological parameters and if you don't follow the Ilizarov principles and the philosophy, you cannot gain a good effect in radiology on Ilizarov technique. And lengthening over the nail, you have seen the poor regenerated bone when you are going for lengthening, and if you don't follow the biological parameters of the Ilizarov, and then you can get a very poor regenerated bone, and that is a problem for the patient. So the lecture was given by Professor Novikov, was a very good lecture, learning from all orthopedic surgeons, and you can learn a lot of things in case of regenerate bone. Thank you very much, Professor Novikov, for elaborately taking the effect of Ilizarov in radiology and at the same time regenerate condition under different conditions. Thank you again.
Thank you very much, sir, for sharing your knowledge. Now, I would like to request Professor Omar sir to share his knowledge regarding the presentation. Sir, please.
Okay, thank you so much. Thank you for Dr. Novikov also for nice presentation. I want to ask him one question. How the patient can be protected from the radiation? Because personally, I am protecting my patient from excessive radiation, especially the genitalia by the lid. Is it you also he's protecting the patient from radiation or not? Thank you so much.
Very good questions, because from our medical education, we know radiography is not so good for healthy, and
Yes.
all of our patients we give protection for this area, and area which you say.
Genitalia.
Just now coming another time and some, how I can say, digital radiography with another technique of our picture. And last years we use only digital X-rays. And one more, we have, how I can say, some very old support. For example, red dry wine. Many patients are protect with this recommendation because some grape juice is very good protect. And with my experience, my opinions, our amount of radiation not give patient any trouble for health, because so many patients with so many stages, with so many X-rays, and on the final patient marriage has baby, work, and continued. Some patients contact with me more than 35, 40 years and haven't any problem with health. And I cannot say our control with radiography give some bad position for health. But you're absolutely right, we give protection.
Thank you so much. Thank you.
Thank you very much, sir. Now I would like to request Dr. Shamsul Huda sir to share his knowledge. Sir, please.
Yeah, thank you, Dr. Tanvir. Thanks, Novikov sir, for such a wonderful, elaborative presentation, sir. It was a great learning, sir. We have learned a lot of things again and again. Like you can say, when there is a less regeneration, we have to go for according to method. We have to stabilize the thread. That is very important. We have to stabilize the deformity. We should exclude any infections. So my question to you, sir, that after doing, if there is a less regenerate in a case, by any means, after doing a cordial method, after doing stability, even if there is less of regenerate, shall we go for some bone graft also? Bone graft or not, sir?
In my experience, we never use bone graft. Sometimes we reduce our lengthening. Sometimes we stimulate with K-wire. Sometimes we make again like osteotomy. This is not osteotomy. We stimulate with some physical action inside, not near the regenerate. And sometimes we change diet. For example, patient use only yogurt, not bread, not meat, not calcium. So many young girls, for example. And this is very important because another maybe topic of lecture, when we need support, give patient instructions for food. very important. Without food, we cannot continue normal life, including our treatment. And during last 25, 30 years, when radiologists give us doctor stop, we stop. For example, patient has defect, and for dock inside we need 15 centimeters. Possible, but impossible get in one time good result in short period. And just now we can calculate before treatment patient come with severe problem, and this is severe problem, for example shortening 10 centimeters or defect more than 10 centimeters, means more than 10 months patient will in our hand. In my experience, I haven't good excellent result if patient with Ilizarov frame more than 6-7 months. Result will come, but not excellent. Maximum good. And just now, I know after 5-6 months will come problem, big problem, sometimes severe problem, sometimes complications. Means I delayed my plan minimum for 2 stages. And if patient need big amount of lengthening twice, and just now I haven't patient with defect, and this is patient haven't bone grafting. I don't know answer for your questions, but during the lengthening, radiologist give me instruction. I need continued lengthening or no, because condition of bone, this is number one. If, for example, potential of soft tissue near the bone cannot give good blood supply, like we can see during the treatment of defect, this is a soft tissue problem, and then we need reduce our plan. And just now we haven't patient with bone defect after lengthening.
Can I add with this question to Dr. Shamsul Huda's question to Novikov?
Yeah. Please continue, Dr. Bari.
Where you are looking at, you have a very bad regenerative bone, that is a bone, is lengthening. This is number one. Now we go for drilling with K-wires to stimulate the regenerate area.
Yes.
Multiple drilling in the 2 fragments. This is number 2. Number 3, you can go for autologous blood infiltration. You take 3, 4, or 5 cc blood from the patient's blood, and then you can put there. This is number 3. Number 4, when you are looking that you have a bad regenerative bone, you can go for little bit compression. Then accordingly, you can go for distraction. Wait for some days, you can go for distraction. Then in my life, I have never done any kind of bone grafting in Ilizarov with Ilizarov apparatus. Never. Because you are creating the bone, you can do that, but you are violating the principle of Ilizarov. We are creating regenerate bone, new regenerated bone with Ilizarov apparatus. That's why you don't need to go for any kind of bone grafting in case of Ilizarov. So you can go, if you target going for lengthening for 10 centimeter, avoid that one. Tell your patient to go for again compression. Second time you can do the surgery. These are the main important points that I am agree with no. Okay.
Thank you, sir. Thanks a lot, sir. Agree, sir.
Thank you very much, sir, for a great discussion. Sir, I have last one question, sir. What is the main cause of fracture regeneration, and how we can overcome this fracture regeneration?
This is answer Novikov can tell you. Faster lengthening, Faster lengthening, you must know the biological destruction of biology. Faster lengthening can lead to premature consolidation. Faster lengthening. And slower lengthening can give you the poor regenerated bone also. That's why you must follow the biological principle of the Ilizarov. 0.25 or 1.25 8 times a day, 1.25 8 times a day, or 0.25 4 times a day. This is the principle of Ilizarov. 1 millimeter 1 time a day, this is not a good. Faster lengthening can lead to premature consolidation. Slower lengthening can lead to poor regeneration. So these are the principles. The effect of Ilizarov in radiology, if you don't follow the biological parameters given by the Ilizarov, then you will not have a good outcome with the Ilizarov apparatus. You know, lots of people are doing hybrid, putting all chances in the tibia with the ring, and they're telling you they're doing Ilizarov. This is not the purely Ilizarov. Biocompatible thin wires, elastic wires coincide with the properties of the bones. Properties of the bones are elastic, the probability. It gives flexibility with Ilizarov wire. So this is by K wires or Ilizarov wires, you can do a lot of things by maintaining the biological parameters given by Ilizarov. This is, I am true or not, I don't know. Whatever I have seen in my life, you can do whatever you like with Ilizarov apparatus only by following the principles of Kurgan pattern. What they are doing, they're playing with wires and rings. You can play with wire and rings. So whatever you like. Okay.
Dr. Novikov, sir.
Okay.
Yes, sir. Thank you, sir. Thank you very much, sir. Professor Novikov, sir, would you want to say something in the last moment, sir? The last few words.
Yeah, I want to say thank you very much for all of you. And, Bari, you finished or you continued? Oh. Dr. Tanvir, according to your question, sometimes we have, not sometimes, with baby we have very often this situation when one X-ray show us a big distance between fragment, and sometimes doctor understand, oh, I can give a patient a few days rest, and immediately coming situation when periosteum of baby not give permission for lengthening. Immediately periosteum consolidate space between fragment, and we have three options with osteotomy, not so good. Continuity of lengthening, and screw is screw, rod is rod, and with forces will come in situation when we increase distance between ring, and then come in situation like that, in one moment, not so good moment. This moment I show, this was in my hand, not so good, because patient feel severe pain. Or another, little bit back distraction forces between, give patient good painkiller and little bit shake, and then start again. This is third way for me, more easy and not how I can say give us a big negative for patient, and we can easily continue it without operation theater. We can continue with our treatment. our lengthening, our procedure. And colleagues, I invite you in Mecca of Orthopaedic, I invite you like Dr. Mirza Muradov in Kurgan. And just now we start a new way. Dr. Bari already has this when the doctor come and shoulder to shoulder near the experience of doctor. And just now, I think some Ilizarov's experience go to the Uzbekistan. And if from India, Kurdistan, or Bangladesh,
Thank you.
will come, only your patients will have benefit. Thank you very much for your time.
Thank you very much, sir, for your nice talk. Definitely, the knowledge of Ilizarov will be spread all over the world, and it's already spread out all over the world. I would like to thank OrthoTV for helping us to arrange this type of academic program, and definitely Bari Saint Specialized Hospital for sponsoring our program. Dear viewers, I'm Dr. Tanvir saying bye-bye today. Hope we will connect you in the coming Friday with another magical Ilizarov topic. Till then, I would like to say bye-bye to all of you. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.